to be having a very, very fun and exciting presentation from Dr. Rostami. Just a quick reminder, we're going to be sending out a Google form with where you can send in your email so we can send you the certificates towards the end. And we'll have a Q&A session if you want to unmute your mic, or feel free to type it in the chat. And McKenna, do you want to add anything else before we introduce Dr. Rostami?
That sounds good. Just make sure you stick around so you can get the link to the Google form. And if you miss anything during today's presentation, or you want to go check out any of our other ones, be sure to go see our YouTube channel because we upload every Friday's speaker there. So,
and without further ado, we welcome you all to our presentation with Dr. Rostami. So Dr. Rostami, you have the floor to speak, and thank you so much for coming here today and speaking with us. We're so excited.
Hi, how are you guys? My name is Soheila Rostami, as you know, and I'm an oculo-facial plastic surgeon. So I know that you guys are interested to become physicians and surgeons. And I thought that as being a female surgeon and in the previous, when I started my career as a female, it was a little bit challenging. And considering the women's movement in these days, in this era, I thought it would be very interesting to talk about a woman being a surgeon, being a woman and a surgeon would be an interesting topic to talk about. So I wanted to give you a little bit of history. In the past, in medicine, we have had, and many people talk about famous and amazing different male surgeons and physicians, but I thought many of you may not know about very wonderful previous surgeons that we have had throughout the history that have been very important for women's history. So we're going to start with Metrodora, who was a Greek female and is from 200 to 400 BC. She was one of the oldest medical textbook written by her. And she was very innovative and pioneer in surgical techniques for breast cancer and uterus cancer at a time that was not even known. And she created many of the surgical procedures that was used to be able to treat uterine cancer and breast cancer in ancient time. In 12th century, the first gynecologist female was named Hildegard of Bingen from 1098 to 1179. She was born in Germany, and she was born in medieval time, and she was helping ladies to be able to have all different services for GYN. In 16th century, we had midwives created by Louise Bourges in 1563 to 1636. And she actually, in France, created the nursing midwives career. So many went to her trainings and became the midwives at that time. And actually, there is a story to it. She was the King Henry V wife's nurse that would give birth to many of the King Henry's kids. And then she became the famous midwife and taught others how to become midwives.
Dr. Rostami, so sorry to interrupt, but I think it's still on the title screen for us.
That's okay. I think it's fine.
That's good. Okay, great.
Yes, I like it, actually. You guys follow it with me.
Yes, and if you'd like to present it in the presentation mode, feel free to do that as well.
Yes, I have. No, I thought that this is good because it's very short, actually. I like the history. I thought this was really nice. There are not that many historian written about female physicians. So I thought this is good, and I would have given it to you as the, I will give it to you as at the end as my resource that I use, because I thought this was really nicely done. So
yes, I love hearing from it.
yes, so because I thought this was really nicely done. So Florence Nightingale is born in 1820s, and she's the one that created the, remember the old time they used to not wash their hands and go from one patient to another to another. So she actually, there's a movie about her that she was the one that discovered when they go, and this was, they were examining the patients, and she would go from with the surgeon, she would go from one patient to another, and she figured it out that they're not washing their hands and they're causing infection with the other patient, and that's why they have such a high number of deaths between the patients. So she was really very, very important in discovery of infection that can be going from one patient to another. And then she became the head of the St. Thomas Hospital in London. So this is actually, if you guys look at the Florence, Florence Nightingale, you actually may find the movie, and it's a very interesting movie. In 1849, first woman graduated from American Medical School, and her name, and their sisters, actually, group of sisters, Elizabeth, Emily, and Marie, they all graduated. They're Blackwell's family, and their work in the Women's and Children's New York Infirmary, Women and Children Hospital. So they were very important in opening the door for other physicians to be able to graduate. But you have to remember, ladies, I know that we have gentlemen too, but I wanted to remind you, at this point, they could become surgeons, but they could not vote. Remember that. They couldn't vote, none of them. In 1863, first woman surgeon employed by the US Army. It's also very important to remember in the Civil War, Rebecca Lee Cropler was one of those people that was very important. No, actually, she is the first Black physician that graduated. And then first Native American, which I'm always very impressed during the 1800s. So something was going on during the 19th century, 1800s, that we had the first US graduating physicians, female physicians. We have the first Black female physician. We have the first Native American physician. And they're also the first Black female that graduated helped during the Civil War to take care of many of the veterans from the Civil War time. But as you can see, I don't know what that era was going on, that so many of these females blossom and be able to become surgeons and physicians. So I'm gonna cut my talk about the history short in here, but I really like you guys to, and I will send you the link. I want you guys to read about it. It's very interesting, who opened the door for us. I'm gonna share my other, let me, so how to start a practice. I think that it would be very important for you guys to know my journey, to be able to respect that I can tell you guys how you can start a practice or how you can become a surgeon and trust yourself that you can become whoever you want. So I went through ophthalmology, and then you have, so let me give you the pathway. So you have to go undergrad. So my undergrad was a chemistry major and I was a physics minor. Then I went through med school, and then you know that med school, you can go either become a MD, PhD, or you can become MD. There are people that are also DOs and doctor of osteopathy. So that's another way to go to become a physician. And you can choose any of the residency programs you want. So it's not just one pathway through med school. You also can go through doctor of osteopathy. But there are different thoughts, different way of approaching medicine. So two different approach. I'm sure at this point, you guys all know about these things. But after med school, you have 1 year of internship, and then you have residency, and then you have fellowship, and you can choose different fellowships. So what I chose as my internship, they call it transitional. So you either can choose medicine, surgery, or transitional. If you're going to any of the surgical fields, many people choose surgical internship. But there are some people that pick to become a surgeon, but at the same time, they don't go through the internship as a surgeon. They go through it as a transitional because they want to learn a little bit more about medical sides of the medicine as well. So that's what I chose. So you do partly internal medicine, and you do also partly surgery. So you learn how to do many of the surgical procedures, as well as learn a lot about how to take care of a patient that has multiple different needs in the hospital setting. Then after that, you start your specialty. And ophthalmology has between 3 to 4 years of residency, depends on where you go. And then you apply during your second or third year, you apply for fellowship. So, and I chose oculo-facial plastic surgery as my fellowship. And so you go through 2 to 3 years of fellowship program. So I graduated in 2000 from all my training. And then I joined a group of physicians that were all ophthalmologists, and they were all general ophthalmologists. So not every doctor choose to do fellowship. As soon as they're finished their residency, they can start working. They can take their boards and start taking patients and open either practice or join other groups. I find out that that wasn't for me, and I wanted to start my own practice. So I don't know if you know, but when you join a group or a hospital or any other subspecialties or multi-specialty groups, usually when you sign a contract, in the contract, there is a restrictive covenant. These days, they don't look at the restrictive covenant that very kindly. So, and what does it mean? Means that in that area that you're practicing with that group, they put a restrictive distance. So within 10 miles of any of their offices, you cannot open any practice. Since in 2000, I joined the group that was in Maryland, I decided, because their restrictive covenant at the time was huge, I couldn't really practice in DC metropolitan Maryland. So I decided to come over the bridge and come to Virginia and open my own practice. Solo practice these days are very difficult. So I would not recommend, if you guys graduated, to try to open a solo practice. So, but very rewarding. I have been very happy and excited to be able to have my own practice. In 2010, we created a cosmetic arm with my first office, which was in Reston. Then 5 years later, in 2015, we opened the Sanctuary Cosmetic Center, and I hired an associate. So in 2019, we opened our third office in different location in Northern Virginia. So at the present, in 2020, let me tell you, this is very exciting for me before COVID hit. So that's the reason I put 2020. So things has changed since the COVID came. So, but in 2020, I had 3 offices. I still do have 3 offices, but the third one, which I opened in 2019, because it was a baby and then COVID hit, we have decided to make it a part-time office. But at that time, we had 2 master estheticians. We still do have 2 master estheticians. We have 4 medical assistants, 3 cosmetic consultants, 1 director. We have many volunteers that come through. We have medical students that come through our office. We had 2 full-time oculoplastic surgeons. At the moment, we only have 1 full-time, 1 half part-time. We used to have 2 part-time plastic surgeons, and at the moment we are in the process of interviewing. So that's the reason I put the way it is for 2020, because COVID has made a lot of changes in our offices. I wanted to show you that different procedures that we do. We do many different procedures, laser procedures, including hair removal, skin resurfacing, radiofrequency, tightening, skin tightening and resurfacing, BBL, IPL, microneedling, RFs, skin tightening lasers that we have. We have many different products of different companies, Galderma, Allergan, and Merz. For injections, we do thread lift, we do a lot of facial, microneedling, dermal infusion, dermaplaning. I personally perform any surgery neck up. I do a lot of eyebrow lift, eyelid surgeries, mid facelift, lower facelift, neck lift, many of the minimally invasive procedures for the face. We have fully accredited surgery center. And as you can see, I'm a multiple board specialist. So I have different boards. I sit on the American Board of Cosmetic Surgery. I'm also president of Medical Society of Northern Virginia. So I'm pretty established in my profession. I'm not gonna go through this, but I wanna show you, this is our office. And I'm gonna go through some of our before and after. So give me a second. Let me show you some of my before and after. Can you see the screen again?
Not yet.
Okay, let me share. Hold on for a second. I don't know what happened. Can you see it now?
Yes. Yes, we can see it now.
Excellent. So these are some of the procedures that we do. Upper eyelid blepharoplasty, which I have thousands of it. This is the eyebrow lift. These are some of the eyebrow lift. This is trichophytic eyebrow lift. So this is again upper and lower bleph. So I don't want to go through every one of them, but let me see. I want to go through and show you guys some of the facelifts. Yeah, these are some of the facelift. This is a liquid facelift. So this is only done by, excuse me, I'm going to put the battery, connect this to it. Hold on for 1 second. Battery. So this is something that is a new technology is helping us without really doing surgical procedures or combining surgical procedures with fillers and neurotoxins, be able to achieve improvement of the aging. And this is combination of neurotoxins with the fillers, with the volumizers to give the patient better look. So this is also another liquid facelift. So as you can see, these patients already had facelifts, but they don't look that great. So combining it with the neurotoxins, fillers, and volumizers, you can get a better look and better appearance. Again, another liquid facelift. Yeah, liquid facelift. So these are all just combination of fillers and neurotoxins. This is the lip injection, which a lot of youth now look after, which I really don't like those pouty lips that they don't look very natural. But as you can see, these are much more natural looking lips that hardly anyone can say that they have fillers in their lips. It doesn't have to be the way Kim Kardashian's or the rest look. It can be very natural done. So that's the reason I'm putting these in the pictures, because it really doesn't have to be those really blown up lips. It can be very natural, simple, very normal looking lips, but a little bit improved for the patient. So this is the end of the presentations on the screen, but I wanted to talk to you about being persistent and give you a little bit more about my journey, because I know you can get these online. I think that very easily you can read about the history of female physicians, but there are certain things that I think that I can teach you by telling you about my life that is very hard to get from the internet or books. When I was 17, 18 years old, I was born in Iran, and at that time, Iran was going through revolution. And things were changing. You guys are too young to remember. And many of you probably have no idea that this has happened in Iran. But our lives were totally changed. The revolution happened when I was 12 years old. But then I wanted to pursue my education, but I was not allowed to go to university for some reasons that I don't want to go into. So my parents, knowing that how much I cared for education, they decided that for me it would be much better to leave the country. So I went to a neighboring country, Turkey, to be able to get a visa to come to US. And at that time, because there were so many countries were pretty much through similar thing, and especially a lot of Iranians were going to Turkey to be able to apply for a visa to come to US. It was not easy to get the visa to be able to come to US. Anyway, I was able to make the journey, get the visa, and come to US. What I'm telling you, this is in 1985, so it's a long time ago. And at that time, being a foreigner, immigrant, and I was on a student visa coming to US, many people would make fun of me saying that I want to go to med school and become a surgeon. I knew I wanted to be a surgeon from day one. So many people used to make fun of me. So I want to tell you guys that when you have a goal and you decide that this is what you want to be, please don't let anyone encourage you. You have the capability and ability to become whatever you want. You can do what you want to be. And that's, I can tell you, I'm the proof of it. I came to US with a student visa as a female in a foreign land from Asia to another country, another continent. And I was able to achieve what I wanted with very difficulty. I can't say that it is with ease, but with difficulty, but I've been able to do it. I never gave up my dream of being a physician. I always did my best. I was working. By the way, financially, I also had difficulties. If any of you guys have financial difficulty, also remember, finance is not a blockage. Maybe difficulty, but it's not a blockage. You can get to where you want to go. So I had the financial difficulty. I had the cultural difficulty, language barrier. All of these I've been able to overcome to be able to achieve what I wanted. So I think this lesson is much more important for any of you to learn. And I wanted to tell you that be persistent, do your due diligence, make sure you work very hard. At the end, you get the reward. Nothing comes easy. Everything has its price. So you have to work hard. You have to do your due diligence. You will get the reward. This is something that I don't think you may be able to, you can read it, but when somebody tells you and tells you their journey, how they were able to do that may give you that strength to know that you can get there. But I wanted to also tell you that being a surgeon, maybe people say that, oh, you can make money, you can do this, you can do that. Please don't do it for that. Do it for what you want to do. If you are passionate about it. Every day that I work, I enjoy my every day, even the days that I'm really having a hard time. Why? Because this is what I wanted to be. This is what I want to become. So my dream was to be a surgeon. So every day I wake up, I'm so happy. It's like I'm going to vacation every morning. It's a very tough vacation, but I love it. I enjoy every minute of it. I never, challenges in surgery is never bother me. I actually learn every day from a patient that is a challenge to me to become a better surgeon. Little things that make the day difficult, I consider it a learning lesson and I enjoy that learning lesson. So it doesn't bother me. I enjoy every day. So that should be the goal. That should be what you strive to. So this is what I wanted to give back to you, because any of the things that I mentioned to you that can be easily looked up. I know how savvy you guys are to be able to look up anything, but trying to get what my feelings are very difficult to get that. And I wanted to give you that feeling, that energy, that security that if you work hard, you can get to where you want, but it has to be for the right reason. Another thing is that I wanted to pass on is that, remember, when you become a physician, when you become a surgeon, people trust you. They come to you because they trust you. They want to get help from you in either way. If you become a hematologist, if you become an oncologist, if you become a cardiologist, you see the patient as a person that needs and wants you to care for them. Don't ever forget that. They trust you. They put their trust in you to do the best you can for them. So that we take an oath at the end of our medical school during the graduation, and you take the Hippocratic oath. That Hippocratic oath, I never take it lightly. I always go back to it. And you swear, do no harm. And remember that money is not the goal. Money is just the reward of it. So you always have to think about it. Why am I doing this? And who am I? I am at their service. I'm supposed to make them they have put the trust in me, so I have to deliver what they want. And if I cannot deliver, I have to be very honest with them, and I have to tell them I'm going to send them to someone that may be able to deliver that to them. So I hope these lessons are more important than what I've talked about before. And now I let you guys ask me any questions you have.
Yeah, I just want to say, Dr. Rostami, that was an amazing presentation. We loved hearing from you. Everyone, if you guys want to unmute your mic or type it in the chat, feel free to ask any questions.
And Carla had asked, she said, are you open to mentoring students interested in this field? If so, how can we reach out?
I always do that. I told you I'm very open to that, and I have had many medical students, many students, undergrad even, who are interested to see what the field of medicine is, to come and spend time with us. I will share that information with Alexis, and Alexis can share them with you. Is that okay?
Yes, that's perfect. Thank you so much.
No problem.
Does anyone else have any other questions?
I have a quick question. My name is Lindsay. Thank you so much for just giving us such an encouraging presentation tonight. I was just wondering, have you had any experience working with pre-physician assistant students or physician assistants in your career? This is what I would like to do in the future. So,
yes, of course. Physician assistants are what we call right hand, but I'm lefty, so I call them left hand. So I love my medical assistants. I love my physician assistants. We have a very symbiotic friendship and relationship. So yes, I care for them very much. So anytime the same story goes, so I will forward the information to Alexis and she can share with any of you guys. So yeah, feel free.
I have a question as well. So how many years total, like, you know, did you have to attend medical school, including like residency and fellowship, to accomplish this career, or, you know?
Yes. So 4 years of undergrad, 4 years of medical school, 1 year of internship, 2 years of residency, 2 years of fellowship. So it's a lifetime of going through training.
Okay, thank you. Was it hard? Like, I know that medical school is hard in general, but like, how do I say it? Did at any point before, like, you're actually getting to interact with like patients and everything, at any point did you know, like, okay, this is for me? Because I know, like, it's hard to know that while you're in school. You're just like, oh my God, this is, you know, hard, the school part alone. But like, at any point in school did you like, okay, it's hard, but I do know that this is exactly what I want to do, you know, like, because I know some people change what they want to do when they're in medical school. So at like what point, or at any point, did you know, like, you know, it's difficult, but
Yeah, let me tell you something. It is okay to change your mind. You decide you want to be a doctor, for instance. You apply to med school, you get accepted. But I had friends at the beginning that they started med school. They thought this is not for me, and they're doing very well. So remember what I said. Remember the goal. The goal is that you find your way in a way that you know that career is going to make you happy. If by any chance you even become a physician and you'll see that this is not for me, I cannot deal with patients every day, you can switch career. It's more difficult the more advanced you are in your career to switch, but I don't say that you should stay in that field just because it's difficult to switch. Yes, medical school and becoming a physician is very tough. But if this is the goal that you have, the reward you get overcome the difficulties for everyone. It picks the right person. When I was a freshman and we just came in to our welcoming meeting, the dean of med school said, look to your right, look to your left. Half of the people you see at the end on your graduation day, they're not going to be there. And it is okay. It's not anything wrong with it. I have one of my classmates decided he loves to play piano. He cannot stand, you know, and he was a very smart guy. That's why he got into med school. But he said, I don't enjoy this. I like to play piano. My parents want me to be a doctor. I don't want to be a doctor. And he started playing piano for different restaurants, you know, so just, and gave up med school. Parents were very upset with him. So at the beginning, they kind of dissed him. But tell you the truth, he has a fun life. He's playing piano. He's actually very good at it. And I keep up with him. I keep in touch with him. He's married with kids, very happy. Think about how unhappy he would have been if he would have been a doctor. He would be a miserable doctor, treat the patients miserably because he's not happy. So you have to like what you do to be a good person in that field. If you're not happy in your field, you're never going to be your star, you know? So don't force yourself, but try it. If you think that I think I'm going to be a good doctor, start it and see how you like it. You didn't like it, you change your career. Parents and family put different pressure on us. Those pressures, I had them, totally. Being a Middle Eastern, they only think two things exist in the whole world. Either you can be a doctor or you can be a lawyer. That's it. There's no other career. So I had those pressures on me too, but I really wanted to become a doctor. So I didn't care what my mom says or my dad said. Do you think I would go through this hell of a journey in a different country, in a different culture to become a doctor for my mom and dad. No way. That's not gonna happen. I did it because I wanted to be one, because I cared. The more I got on a higher level of it, the more I liked it, the more I wanted to be with patients, the more and you learn that you're good at it, you know? So, and I picked the thing that I really liked. So, I mean, at first I was a reconstructive surgeon. So I did a lot of reconstructive surgery, but I saw that I don't like it. I don't enjoy it. I like the cosmetic side way more. So I switched to cosmetic. Reconstructive and cosmetic are very similar. So it was easier for me to transition to cosmetic. So that's how I transitioned to cosmetic.
Thank you for that explanation.
You're welcome.
Going off that, one of the questions in the chat says, when you approach a person suffering from trauma in the face, example, due to a car accident, what is your thought process when it comes to what your first steps should be? So if you deal with that, where would you start?
So the training for the trauma is that you have to do the ABC, airway, pulses, the ABC that is very important, cardiac. So you always have to go back to the origin. So you have to make sure the airway is clear. So survival is very important. So that's where you go right away. You make sure their pulse is okay. So these are the steps, and always you go back to that original 1, 2, 3. So that's when we see a trauma patient, that's what we think about. But I'm mostly the face is divided. So neurosurgeon, oculo-facial, ENT, oral maxillary facial. So there are 4 specialties just right here. So because it's very complex, okay? So when trauma happens to the face, we do multi-specialty approach. So they usually assess the patient before they call the subspecialist. So they call neurosurgery, they call me, they call the ENT, and they call oral maxillary facial. So we usually divide the surgery among us, and we all 4 work together. So I did 10 years of reconstructive surgery at Inova Hospital, Fairfax. So all 4 of us sit together. If we need the neurosurgeon usually puts whatever they need to do. Then I come in, I try to create the orbit, create the muscle back together. So this is how we approach to the patient. So I hope that was enough explanation. It's a very complicated and complex situation when it's a head trauma.
Right, for sure. Another question in the chat says, thank you so much for your time this evening. And they're asking, what would you say an average day at your practice is like? Are days more or less the same during the week? Or are some days more difficult than others? And based on your schedule, would you say you have a sustainable lifestyle with a decent work-life balance? So a loaded question, but
I don't know, because you would appreciate life and work balance. You see, I'm a workaholic. I love work. So to me, yes, it's balanced. But you guys, maybe when you come and see me, you may see, no, she's always working. So I don't know. I'm not going to say that it's balanced. To me, it is. Let me tell you, I'm married with 2 kids. I have 2 boys. My husband of 26 years has been my anchor, and he actually ground me. Whenever I'm working too much, he just comes and says, hey, you're working too much. So I have to okay, I just have to kind of give myself a little bit of time. So me and my husband are opposite of other couples usually. Is the male that is the breadwinner and work hard. So us is opposite. I'm the one who is the breadwinner, and I'm the one who works very hard. And he's the one who spends most of the time with the kids. And not that he doesn't work, he works very hard, but a little bit more flexible with his work. So our children are grown now, but my youngest kid always says that, Mom, I hate you. You never spend time with me. So, but I'm not a mother. I don't know how to describe it. You know, that motherly instinct that some people have is much less in me. I do, when I was with the little kids, I get frustrated. I can't tolerate them. So I'm not good with kids. My husband is wonderful with kids. He's very patient. He has spent time with them. So I knew from the beginning that I'm not a perfect mother. So I told my husband that. And I was very honest with him. He wanted children. And he said, okay, don't worry. I'll take care of them. I said, okay, we'll have kids, but I'm not a good mommy. And he said, okay, no problem. So, you know, it's my day. I usually start, the surgeries start very early. So even during residency and fellowship, they train you. So you have to go on and round on your patients 6:30 in the morning. You have to have everything ready. So surgeons are very early birds. So I'm in the office at 7:30, whether I have surgery or not. I review everything for the day, make sure everything is okay for my day. If I have surgery, I want to make sure that all the instruments for the next day, not for the day, but for the next day, all the instruments are ready. If I need any equipment, it's already ordered. I check and double check to make sure we're not going to run into any trouble. I usually see 25 patients a day if I'm seeing patients. And if I'm doing surgeries, the surgeries, we start at 7 and we usually finish around 4:30. And depends on how long the surgeries are. If I'm doing the whole face, it takes me about 5 hours. So I only can do one full face and maybe one eyelid. But if there are different things, so then they schedule according to the time it takes. Was that enough?
Yeah, I think
Yes.
that definitely
That
answered
was
all
very
of it.
thorough.
Yeah. Another question that came in the chat says, out of curiosity, do you recommend any cosmetic procedures to people in their 20s or maybe some that are preventative?
I do. Actually, one of the things that we recommend depends on what are the different issues patients have. So there are, I wouldn't call them, there are certain things that we say that it should be addressed when they are younger. And I'm not going to say, because we call them, unfortunately, in medicine, we call them deformity, but they're not deformities. It's just a variation. So I'm sure you've seen some people, we have ears that are sticking out. You should deal with that very young age. Why? People are very mean to each other, especially children. So if they have very prominent ears, they should have the plastic surgery, cosmetic surgery to fix those ears, because it affects their personality all throughout their lives. So things like that, and there are many examples of those that each one needs to be addressed, doesn't matter what age they are. So you may think that I'm talking about cosmetic. They are considered cosmetic, but they really, for self-confidence, for well-being, that we recommend those. And I'm gonna also, ladies, I know females are very sensitive about their bodies. And there are cases that the ladies have not had developed breasts properly. And they become very self-conscious when they get to teenage years and a little bit older. And that is another part that for their self-confidence, for their self-well-being, it's good to have breast augmentation. So there are certain things that we do recommend to take care of earlier in age. Why? Because it's important for well-being, for self-confidence. And those are for younger patients. You know, if you have a very crooked nose, it should be addressed in your 20s. It should not be later on, because we do have the science, we have the specialties. So why would you want to go through life with something that bothers you throughout your whole life? So these are the things that, but at the same time, we have to be very careful with patients that have problem with their image. They have illness of self-image. That's also has to be addressed right away. So they need to be seeing psychologists, psychiatrists to learn to love themselves. So there are very fine line when we think about it. So our field has a lot to do with self-confidence, and we can help it or we can destroy it. There are people that no matter what you do, they're not going to be happy because they have a problem with their self-image. Is that a good answer?
Yeah, I think that's a great answer. It definitely, I would think your work has a lot to do with people's self-confidence, and that's really admirable that you can change that for people.
Believe it or not, I do think that reconstructive surgery gives me the most fulfilling feeling. But I tell you, since I started doing cosmetic, I noticed that I help people way more. There are patients that they've been thinking about doing something for so many years and they didn't do it. And as soon as they do it, they get that self-confidence back. I have had patients crying and hugging me. So people make fun of plastic surgery and cosmetic surgery, but honestly, it will change people's life. And I'm very happy to do that for people.
Right. A couple more questions came in the chat. One of them says, they're wondering when the right time to have an underbite correction surgery is. So when does the jaw stop growing, and therefore when's the right time to undergo the surgery?
This is beyond my specialty. So I wouldn't answer this question because it's not in my field. So I'm so sorry, sweetie. You have to go see an oral maxillofacial surgeon.
Another question asks if, I think you already talked about it a little bit, but I'll ask it. Aside from cosmetic procedures, do you ever perform medical or surgical treatments that are medically necessary or have the potential to reduce suffering? So such as growth lesion removal on eyelids or eyelid facial reconstruction after Mohs?
Yes, I do. I do those very much and I enjoy them very much. So yes, my practice is a combination. It's cosmetic and reconstructive. So yes, I still do. I enjoy them very much. I just did a tumor removal from the orbit. And so that's what I've been trained to do and I enjoy them very much.
Does anybody else have any last questions that they want to unmute or put in the chat?
Okay, awesome. Well, attached in the chat is the link to the Google form. So if you guys want to send in your emails, we'll send you a certificate soon. And we just want to say thank you all so much for coming. It was so great attending the webinar with all of you. Thank you so much, Dr. Rostami. The presentation was amazing. And thank you for answering all of our questions. It was wonderful. Yeah. And if
I wanted to thank you guys too. I wanted to say that I love the next generation. You guys are our future. So I care for you guys very